all. A warm welcome to the Government Nurse Facebook page. This OET course is specifically tailored for professional nurses and is essential for those seeking foreign job opportunities. While there are numerous courses available, this is the only program specifically designed to support nursing professionals in advancing their careers. Let me introduce you to our resource person today. She is a graduate from University of California, MA in Linguistics and BA in TESL, and also Diploma in English, YMB University, Sri Lanka. And also, she is a visiting lecturer in English, Faculty of Medicine, University of Moratuwa. Dear Miss Hansamali Disanayaka, the stage is yours.
Hi, thank you very much, Hansika, for your nice introduction first. And very good evening to everyone who joined today. Okay, so actually, I want very good evening from your side as well as students. Yes, very good evening to all of you. Yes, you also can drop me messages, okay, because this is going to be a kind of discussion. Okay, so this is not going to be a kind of very strict or like not a kind of very formal thing. I thought it's better to do it as a kind of discussion and taking your answers as well. Okay, fine. Actually, I'm not able to switch on my camera now because I'm traveling, but since you haven't seen me, so I'll switch on my camera for a moment because I think it's better if not you don't know who is speaking and like so then I would switch on my camera. Plus the other thing is before that I want to know, doesn't it matter if I do this thing in English or sing like or do or I mean like it doesn't matter. Okay, so if you feel uncomfortable when I speak in English and as this is the introductory session, it's better if you feel like it's better if you can speak in Sinhala or mix Sinhala and English. So what is better, students? Could you please tell me about it? So like English, Sinhala, or if is it better if we have a kind of mix of Sinhala and English? What's your answer? Yes, you can come up with any answer, okay? Because you are very free, okay? Yeah, you're very free. Okay, so some says that's okay, English. I would use simple English when explaining that, no worries. Mixing Sinhala and English. Okay, fine, we'll do it like that. How about others' answers? Yeah, just unmute yourself and tell me. Or if not, just drop me a message. Okay, yeah, so I'm getting answers from you. Okay, that's good. Nice. Quickly, yes. You need to send me answers quickly. Because the time is precious for all of us, right? Okay, so most of you say English. I'm very, very happy about it. So, English, Hari. If there is any doubt, then ask it in Sinhala, no worries. Yeah, okay, fine. Then I would do it in English. Okay, since most of you requested, I would use English when explaining. Okay, nice. Okay, very good. Thank you very much for all of your enthusiastic answers and your request to do it in only in English. Okay, so let's do because you know it is also not a kind of mixed thing. So then I also expecting. Okay, so you should tell we should speak in English. Okay, so nice students. I'm very happy about it. Okay, wait. I will switch on my camera and actually I'm traveling. Okay, wait. Okay, students, hope you can see me. And yeah, yes, hello everyone. And actually, I'm so sorry about it. I had to quickly head to my home. So then that's what happened to me today. But anyway, as I promised you earlier, we'll start our session now. Okay, fine. You saw me, right? Okay, you know the person who is speaking, and I'm not going to be an invisible person anymore. Okay, fine, students. Let's start. Okay. Hi, yes, everyone. Let's start. Yeah. So this is I'm not going to tell you anything, I mean, unnecessary details related to it because I know you are very busy. Okay. Then we will talk to the point as this is the introductory session. Okay, fine. So today's focus is on general introduction to OIT. This is what we are going to discuss today. I will be providing you a kind of general idea about this is what OIT means, and this is our plan, and this is how we are going to continue the sessions and those kind of things. I will be explaining you. Okay, so this is about the objectives of today's session. First, I will be giving you a kind of general understanding of the OIT exam. Okay, so OET, you know that that's a kind of acronym. Acronym කියන්නේ short term එකකට. OET කියන්නේ occupational English test. So when we make it as a short word, we call it as an acronym. So OET is an acronym. And its lengthiest run or the long term is occupational English test. I will explain you about the structure of the test, the purpose and the importance of the occupational test for healthcare professionals. Other one is explore the 4 OET subtests. Okay, so just like IELTS, we have 4 subtests for OET as well as it is given here. I think you can see here. That is listening, reading, writing and speaking. So these are the major 4 components of OET test, but we are discussing, right? Okay. And other one is, I will explain you the format of this test. Okay, so we all know that, okay, so we have listening there, reading there, writing and speaking, but we should know what is the format of this exam. Okay, so that's the basic idea, no? I mean, if you don't know the format of anything, how are you going to write it? We can't. Okay, and the third one is understand the key skills required. So what kind of skills do we need to improve in order? A lot of skills students, because it's not going to be something very easy. It's tough. Okay, I should honestly say it's not going to be something easy. It's tough, but it like possible. That means you can do it if you do some hard work. So this is going to be something that you can achieve. Okay, and then recognize the common challenges and the common challenges that the students face. So the doctors and the nurses, so what they face normally, like the challenges, or people say the difficulties in simply. Okay, so like the difficulties that most of the students face when writing this OET exam. Okay, so this is what I'm going to discuss today, and this is the outline. Okay, so that they are the objectives of today's lesson. Objectives in the sense, the target or the aim of today's session. Hope you understood what we are discussing. Do you have any doubts about what I have to like explain you so far? I mean, about the objectives of today's session. Do you have any difficult term here? Quickly drop me a message. If anything is not clear, or you feel like I can't understand or something like that. Nothing, right? Okay, so then let's move on to the other part. Clear? Are the objectives clear, students, or do you have any doubt? Quickly. Yes, just reply. No doubts, it's clear. So that's what you need to tell. Not other than yes. Okay, that's clear. Very good. No doubts. Excellent. Nice. Okay, so now, so first we will do a kind of warm-up task. Okay, so like it's better if you can have your notepad or something, because I am just checking the level of you. Okay, I want to have a kind of understanding about the level. Okay, your English level a bit. Okay, before starting. Because no, I will do, probably I will be doing these kind of tasks later as well. But today also I thought it like it's better if I can have this kind of activity at the very beginning of the discussion. So now what you need to do is like just take a pen and a paper. If you don't have pen and a paper, what you can do is probably you have your phone, no? Okay, so then just open notepad or anything, and then just write the words that I am telling. Okay, and I'm giving you 30 seconds. Okay, if I tell you the term hospital, you have to write all the English words that comes to your mind related to the word hospital. Okay, for example, මම ඔයගොල්ලන්ට sun කියන word එක කිව්වොත්, so the word is sun. So you have to write all the words that comes to your mind in relation to sun. For example, light, okay, morning, afternoon, hot, okay, or something beautiful, okay, anything, any word, but that should be in English. All the words that comes to your mind, you have to write. Okay, so that's what you need to do. That's the very first task I want to do. And this is this is not something related to OIT, but since this is an English test, I want to know, I want to get a kind of understanding about how you are. Okay, because I need to know, I need to know my learners first. That's why I'm doing this warm-up task. Okay, are you ready? Are you ready, students? I'm going to give you three words. That's what. Okay, are you ready? Okay, nice. You're ready. Okay, so the very first word is, okay, wait. I would keep 30 seconds. You have to just stop. Huh? Okay, so the very first word, that is, we will start with something, type 2 diabetes. The word is type 2 diabetes. You have to write all the words that comes to your mind related to this particular word. That the word is type 2 diabetes. Okay, you have only 5 seconds. Okay, your time is over. Okay, so I gave you 32 seconds. So generally, the task requires only 30 seconds. Nice. Now, quickly drop me a message, informing the count, the number of words you wrote, 5, 6, or 7, or 20, or how many words you wrote. Quickly drop me a message, everyone. Okay. Okay. You found only 2 words, 5 words, 8 words. Very nice. 8 in the sense, nice. Okay, very good. 7. Okay, nice. 8, 4, 5, 6. Okay, so that means most of you are I feel it like, so that's 5, 6, 7 level, right? We have some extraordinaries as well, exceptional characters. 9, 10, 15. Very good. Excellent. Okay, very nice. Okay, 7. Okay, students. So then the next word is last word. So we will write, what can we write more? That is, okay, okay. Yeah, I will give you time. Yes, yes. Just drop me your count. No matter. Yes. Okay. 6. Only 2. Okay, doesn't matter. Only 2 also fine. That's your level, no? Okay, because this is something that I wanted to do with you. Other one is, I want you to write about, we will write intravenous antibiotics. That's the word, intravenous antibiotics. It's not just antibiotics, intravenous antibiotics. 30 seconds, huh? Okay, the timer starts. Intravenous antibiotics. So these are the words and jargon that you can see in your test. Okay. So like I got 2 words from your test, one from a speaking test and another one from writing test. Okay, or it is speaking and writing. And I just wanted to give those words to you now. Okay, now the 30 seconds over. Okay, so how about the count? So now it's less than the previous one, or it's somewhat higher than the previous one, probably less than. I'm very sure about it. Okay, yes. 7 there, 10 there, very good, nice. 8, okay, 6. Okay, something unexpected happening. I expected you to write something less than that. Okay, 10, 5. Okay, excellent, nice. Okay, so this is just a kind of vocabulary task that I wanted to do, and this is what I want to tell you, students. That is, when it comes to OET, the major thing is we need to make sure that we have a rich vocabulary. We have a set of rich vocabulary that are related to medical profession. Okay, medical in the sense that might be like I will explain you, but there is a kind of set related to, like we call it as medical jargon. okay, or the technical words related to medicine. And we need to make sure that we are familiar with all those words because those are the words that appear in your exam. It's not like IELTS. Okay, it's medicine is specific. Okay, nice. Then, next question. If you had to rate your confidence in speaking English from 1 to 10, what would it be? Okay, so now I'm asking you to rate your English level from 1 to 10. So, where would you put yourself, students? So, you feel like 6, the 7, the, or 8, or 9? How would you rate your English confidence? The confidence in using English. Okay, how would you rate your knowledge? Okay, okay. Some say I feel like 7. Okay, very nice. Some say 5. Half, right? Okay. Then some things 4. 6. Okay, 5. Excellent. Nice. Okay, that's your self-evaluation. Okay, fine. Excellent. Confidence in speaking, that's at, like that's peak level, right? That's 10. Excellent. Then, if you had to choose the most difficult OET subtest, which one would it be? According to your opinion, you know who you are, right? You know what kind of learner you are. Then tell me, like according to your opinion, what is the most difficult one, or what will be the most difficult one? Speaking, writing, listening, or reading? Yeah. Writing for sure. Yeah, yes, that's correct. Writing is difficult. Yeah, true. Okay, speaking and listening. Speaking is not going to be that much of difficult students. Yeah, it's going to be easy for sure because most of the students they score high for the speaking test. Okay, reading somewhat, listening is somewhat harder. Yeah, because we have to deal with lot of accents. They are Australian, American, British, Canadian. Yeah, yeah, need improvement in writing. Yes, because you want feedback there. You need to understand what am I writing is wrong or correct and how can I write it. And yeah, yes, that's there. And you need to write academically. Academic writing should be there. Academic literacy for medicine. Okay, fine, nice. Okay, so I think that's enough. Okay, so then I ask you two questions. No, that's enough. I'm not going to ask other questions from you. I'm not going to make you tired. Okay, yeah. So the first one is like, give me 1 second. Okay, so I'm sharing my screen. Okay, so this is our very first slide about OET. So OET, as I told you, this is an acronym and we call it as Occupational English Test. So International English Language Test that assesses the language proficiency um, of healthcare professionals. Okay, so all of you are healthcare professionals. So this is to assess your English level or your knowledge and or your proficiency seeking to register and practice in an English speaking environment. So when we are moving to when we are migrating to a kind of English speaking environment, we need to know, oh my God, so how am I going to interact with these people? They are speaking in English. So do I have a good knowledge of speaking in English or can I just deal with them in English? So you need to know and you need to have that confidence there. Okay, and it provides a validated, reliable assessment of all four language skills, as I told you earlier: listening, reading, writing, and speaking. And OET test candidates from the following 12 health professions. It's not all about nurses or doctors, dentistry, dietetics, and other occupational therapy, optometry, okay, pharmacy, and all these things are there, right? And candidates are encouraged to prepare thoroughly for their OET test. That means OET test is not going to be something easy. It's going to be something tough and difficult. So we need to prepare thoroughly. Thoroughly in the sense, like that says that particular word says this is not going to be easy. Okay, this is the overview of OET test. And so we have 4 subtests there. And listening, that will take 45 minutes. 3 tasks are there. And common, that is very common to all 12 professions. Other one is reading 1 hour. So that's 60 minutes. Again, listening and reading, we have 3 tasks. Plus the other one is writing. Writing, that's only 45 minutes. You have to write a letter. So there are 3 types of letters: referral letter, transfer letter, discharge letter. We don't know what kind of letter that you will get, but we like very sure something from referral, discharge, or transfer. That's about writing a letter. That's the writing part. Then speaking, you have to, you have to deal with 2 speaking tasks, that is role plays. Okay, so your examiner and you, so like you have to play the role of the nurse or the doctor, and your examiner will be playing the role of the patient. Okay, or sometimes the patient's guardian or anyone. Okay, yes, so that's how it's going to happen. But speaking, that's only 20 minutes. Okay, within 20 minutes there will be 2 role plays. Hope you understood the structure of the test. Listening, reading, writing, speaking, and reading one is like reading, that's a kind of very lengthy task. So that's why 60 minutes are allocated for this task. Okay, hope you understood. Do you have any doubts about the structure of the subtests? Any doubts you have so far? You can quickly ask, okay, because you are very free and you can ask anything as this is our discussion. If you have any doubts or if you need any clarifications about what I have explained you so far, you can just ask. No worries. No doubts. Okay, nice. No doubts in the sense it's not nice. I mean, if you ask something, then that's also okay. Yeah? Fine. So now we are moving on to listening. I told you this listening one, so that will take 45 minutes. So what are you going to do within this 45 minutes? Okay, so that is about, you have 3 parts there: part A, part B, and part C. That means your listening exam comprises 3 main parts: part A, B, and C. They are very different. Okay, part A, that means that consists of consultation extracts. Some extracts are there. And part B, that's regarding short workplace extracts. So all these parts need some skills, students. Okay, so that is about English. English is not all about, grammar and tenses, no. But in English, we have different techniques. For listening, we have 3 techniques: listening for gist, listening for comprehension, listening for details, and like that. We have some techniques to follow it, like when it comes to listening. Okay, so those techniques will be taught to you in our program, and then it won't be something very tough, but you need to practice. Okay, but I will be teaching you the techniques and the skills needed for each part. Part A, this is what we need. Part A, we need listening for specific information. Okay, that is the skill we need. Part B, that is something very different. Then we have to have the skill listening for gist, listening for opinion, and listening for purpose. Okay, so that is the sub skill we want to practice. And part C, this is very lengthy. Okay, you have to listen to a kind of lengthy presentation, or it might be a kind of lengthy interview. Okay, a doctor presenting something about it, or a kind of, or like addressing a gathering about some topics, about a kind of new antibiotics or something. Okay, so then that's going to be somewhat lengthy and it's something hard. Listening part C is not like part A and B. Part A and B somewhat manageable, but part C is something hard, as I told you. So you have to listen to a recorded presentation or an interview. Okay, so yeah, then here we need all these techniques that we like that we got or that we acquired in part A and part B to write part C. Okay, so now you got a kind of understanding about what is listening and the listening, the structure, the format of this listening test. Okay, and the skills that we need to improve to do that. Okay, listening for specific information, listening for detail, just opinion, and the purpose. And C part, we need to, it is a kind of mixture of all these sub skills. Okay, yes, fine. Then, do you have any doubts about listening? Ask. That's your time. If you have any doubts about like the format or the time or the like anything, yeah, this is your task, your time. Yes. Okay. Uh, you don't have questions. You have questions. So what are they? Ask. Doesn't matter. Uh, I will show you. Yeah, I will show you at the end. Okay, the like structure of, okay, I will show it. Okay, fine. Good. Nice. Then the second one is reading. So the reading also you got to know that that is also something like this that takes 60 minutes, right? Listening 45, reading 60 minutes. My God, that's an hour, right? So what are we going to do? Like reading, that's hour. So why do they allocate an hour for reading? Okay, so this is that. So we have like that consists of 42 questions. Okay, out of 42 students, at least you have to take a power 29. Okay, like I mean 29 is the level, but it is better if you can at least 30. If you can score at least 30 in this reading test, then you will be able to pass the exam. But if you get less than 29, then that's a kind of failing. Okay, so at least you need to, if it is 42, you have to like achieve at least 30 there. Okay, yes, that's about reading. And here also, like here the thing is, students, the time is so limited. And most of the students who wrote this test saying that, oh my God, so the thing is, the test was okay, manageable, but I was running out of time. That's their answer at the end. And last week also, one of the students from, she was from Dubai. So like she wrote the exam and she told me like, so the thing is, she did her speaking well, listening well, writing also she managed, but the thing is, like for the reading task, like the time was not enough for her, so she told me like probably she would fail the exam because of that. Okay, because I mean at least we need to get 30 to pass the exam. Okay, fine. So this test, part A, that is a kind of very expeditious reading task. That is about, it's going to be something very quick. You have to be very quick to get all the information. You have to read, like, I mean, reading, we have some techniques in English. Okay, so reading techniques are, I don't know you have heard about these things or not earlier, but I will be teaching them. So these are the techniques of reading. A skimming technique there, scanning there, and there is another technique called detailed reading. Okay, so these are the major techniques that we need to practice when it comes to OIT reading test. Okay, so if you are very talented in these three sub skills, you can pass the exam. Okay, so I will be teaching you how to do skimming, how to do scanning, and then the detailed reading. This is something hard, but we'll practice. Okay, yes, because you need to have a skimming technique to face this part A reading task. Okay, skimming should be there. And part B and C, we need scanning and detailed reading. Okay, so if you search what is scanning and reading in Google, then they will tell you, or you can just watch some YouTube videos as well if you feel like, "Kani, I don't know what is skimming and scanning." So you can just search it in YouTube or Google and just try to find it. But if you have doubts now, but anyway, I will be explaining it to you after the like I mean when we start the course, I will be explaining everything to you, and this will take some time. Okay, they are the techniques we need: skimming, scanning, and detailed reading. Okay, fine. So here part B and C, especially C part. So like that assess your ability to identify detailed meaning. So that's why I told you we need to practice this detailed reading to understand detailed meaning and opinion in two texts. Okay, so these two texts are not going to be something very short, not brief. They are very lengthy texts. Okay, they are very lengthy, and sometimes they consist of like 5 to 6 paragraphs, sometimes more than six as well, we can see. So generally, that's about 6 paragraphs. Okay, so that is about part C. Okay, so you have to deal with two lengthy texts there. Yeah, so we need this technique to follow. That is detailed reading technique. Okay, so all these sub-tests, we have some sub-skills to follow, students. For example, I told you when it comes to listening, I told you we need to practice the skill of listening for details, listening for comprehension, listening for gist, purpose. So we need to follow those skills. Okay, reading, that is skimming, scanning, and detailed reading. So only these three skills are enough to pass the exam. But the skills are not going to be easy as you are practicing it first time. You need to give yourself some time to practice it. Okay, that's it. And other one is writing. As I told you earlier, you are given three options, but no options are there in the exam. So you have to practice all these three letter structures: transfer, discharge, and the other one referral letters. Okay, so but I don't know what kind of letter that you will be getting in the exam, but we will practice all these three. Plus the other thing is the writing test takes 45 minutes. Okay, 45 minutes there. 40 minutes write your letter and 5 minutes at the start to read the case note, because the case note is something lengthy, and then you need to understand the patient situation. Okay, for example, the patient history, okay, and current medication. And so if it is a referral letter, so then there might be some other details as well. Okay, so there are a lot of details that you need to focus on, but 40 minutes there, so the time is really enough to write an essay, write a kind of letter. And this letter, so the word count is, or the word limit is 180 words. You can't exceed. So they say it like the letter should be 180 to 200 words. Okay, so if you write, if you exceed the word limit, probably you would lose your marks. They will be deducting marks from your answer if you exceed 200 words. That means that is the limit. You have to write everything within this word limit. That's 180 to 200. Okay, fine. So then when writing thing, you have to have another techniques. They are, you need to know like how to include information, how to exclude information, how to write grammatically. Okay, and there are two other methods of writing letters in OET. One is we can write something using thematical method, and there is another method called like chronological method. Okay, so these things we need to practice. Thematical means, students, you are just, if it is a discharge letter, you are just starting from, starting by giving a lot of focus onto the themes of the case note. For example, you are focusing not only to the dates, but you are focusing on the theme. Theme in the sense, I will show you a kind of letter, then you can understand. Hope most of you have seen letters, right? Have you seen OET letters? No one. You should. Okay. Yes. You haven't seen OET letters. Nice. You should. Okay, I will show you. Okay, so this is just an example. So here, when you focus on this letter, so you have patient details here, then social background, medical history, then medications and presenting complaint, and hospital admission. So, and treatment record. This is your writing task. So the writing task is you have to write here you are going to write a discharge letter, right? Okay, not a referral letter. Write a letter of discharge. Okay, that means you should know what is the correct format of writing a discharge letter. Okay, so when writing this discharge letter, as I told you earlier, we can follow thematic method. Thematic method means we can just use these themes, and according to these themes, we can just write our letter by dividing the information correctly. Okay, so like the paragraph should be divided according to the themes given in the case note. That is thematic method. Okay, and chronological method. Chronological method means you are not going to focus on the themes there. You are going to focus on the dates given here, dates and the years. So what happened in 10th May 2021? So what happened in then this May 2021? Okay, so like that you are focusing. I will explain everything, but I just want to tell you that there are two methods of writing. So one is chronological, and other one is thematical. Okay, you can follow any method. So I mean, there is no issues there. It's up to the student to decide what is the method that I'm going to follow. But yeah, but you need to make sure that you followed one method. Like sometimes some students use both methods. I don't think that's going to be something nice because we can't just have a letter as a mix there, no? Okay, so fine. Yeah, so they are the two methods that we can follow. So here, as it is given, you can write only 180 to 200 words. By including all the information, all the in the sense you can exclude information if you feel. So what is the point of writing temperature here? So I feel like the temperature is not necessary here. Then you can eliminate that factor or you can exclude that factor here. And so that's up to you. You can decide what to include and what to exclude. All these information are not necessary, students. So that is also a technique. You need to understand what is necessary, what is unnecessary by using your expertise, right? Because you are medical professionals and you know what to include and what to exclude. And so the writing part I will be teaching you for sure. But that knowledge should be yours, right? You should have that knowledge of okay, so this is discharge letter. So then I think this part is not necessary to write, but you should have a kind of logical reason. Why do I say this is not necessary? Okay, yeah, so this is an example for a discharge letter or discharge case note. You have to write a letter including this information. Okay, so the time limit is 45, 5 minutes for reading this and 40 minutes for writing your letter. Okay, so hope you understood. Then we are moving on to the other part. That is about so writing. Actually, I showed you only a discharge case note. Okay, but referral and transfer also there. But I do not have a lot of time to focus on this. But I gave you just a kind of rough understanding about like the case note. Okay, so this is all about it. Another thing is last one speaking. This is the most interesting thing, and actually, as an instructor, this is the part that I teach to my students in a very like I also feel somewhat interested when teaching speaking to students. No, I like to teach writing, reading, listening. But the thing is, when it comes to speaking, I can quickly understand is my students improved or not. I mean, like that is the thing. I mean, most of the times, so like after 2 3 speaking tests, then I can understand, okay, so this person is having some improvement or this person is not going to pass the exam. So that thing I can understand because speaking is something like I mean spontaneous, right? It's not like writing, reading or listening. But speaking is something interesting and I like it most. I don't know your choice, but I like speaking most. Okay, nice. Yeah, so this is about role players card. Like this is about your card. So nursing or medicine here. And here the setting is given. That is about maternity ward. Okay, so you are in a hospital for delivery of your third child by cesarean section. So this is actually the patient section. Okay, and you will be given another role card. And here we can see nurse or the doctor. Okay, so this is I will show you the full card to you. If it is something confusing, I will show you the full speaking card. Wait, okay, so I actually extracted that thing only, but I will show you. Wait, this is not going to be something very difficult. If you have if you feel like you can do it, and if you have that confidence, for sure you can pass the exam, students. Okay, yes, I will show you the speaking one now. But you need to allocate a lot of time for this and you need to make sure that you are practicing everything and that dedication should be there. Okay, yes, and you have to write and send it to me. I'll actually the answers on time and then I can give you feedback. Okay, yes, wait, this is what I'm talking about. So wait, I will share the screen. Okay, this is the task. You can see here. This is Actually, not nursing. It is also very same. Like here, this is the patient character. This is doctor. So you are playing the character of doctor or the nurse in the exam. So you are a medical doctor working in an like we have inpatient ward. So your patient is 54 years old and was admitted 2 days ago with right lobe of pneumonia. So then, like actually, you were given all the details and you need to follow this task, students. You need to answer all these tasks given here. That is about, you are given 3 minutes to get ready before the test. So you are given 3 minutes to get ready. And within those 3 minutes, you have to decide what kind of questions am I going to answer? Like, am I going to ask from this patient? Okay, and yeah, and what kind of facial expressions I should like show to this patient. Okay, so that is a different thing because patient handling in the sense we need to follow some structure there. You can't ask all the questions using how are you, like what, how do you feel? No, so you have to have a kind of variety when asking questions, right? There are many types of questions in English because this is going to be OIT, so occupational English test. So there are many kinds of questions and you can use short questions, long questions, direct questions, indirect questions, or like tag questions like that. It should, I mean, your conversation should consist of variety of types. Okay, I mean that variety of question types. You can't ask everything using WH questions. You can't ask everything using do, does. Okay, but when you start, like I will tell one thing. So most of the times, like the instructors advise the students to start a conversation with the patient using do, no? So that's about yes, no, no. Then we can just understand about the patient. For like if you ask what or that WH question very first, then it's going to be something hard. Okay, because you need to understand who is your patient. Okay, so then it's better if you can start your questions using do or just source have or like that yes no questions or short questions. Then you can continue your conversation smoothly and nicely. Okay, but real life, that's going to be something different. Actually, I know that, but when it comes to OET, that is actually they are assessing your English level, no? OET will assess an English level lekane. Enisa, you need to make sure that you are showing your full English level or full capacity of using English to your examiner. Okay, that's how you can pass the exam. Okay, so then what so that knowledge should be there, especially asking questions and about clinical communication. So there are some types that I mean there are some like strategies that we have to use also, and yeah, we'll practice them later, but I gave you just a kind of rough idea about this is what going to happen under this. Okay, hope you understood what I said. Okay, if you have any questions you can ask, just drop me a message, no worries. Okay, fine. So that is about speaking, students. Hope you understood, and there will be two role plays. So first, taking 2 to 3 minutes, your examiner will ask you the questions like, okay, so explain me about like your typical day, okay, at hospital, or why did you choose medicine, or why did you choose the medical profession. So first, examiner will be asking you some general questions from you. I mean, so they are very, I mean, general kind of questions, and what are the good qualities of a nurse, and those kind of things they will ask. Okay, and how do you deal with the kind of angry patient or a kind of irritated one or something. Okay, but then the examiner will be starting the exam, that is two role plays like this. Okay, yeah. And the other one, this is how the test is scored, and you are given marks like this. Okay, so A, B, C plus C, D, E. So level is B level. Okay, that means you need to score about 350 to pass the exam. C plus, no students, no. So at least you need to have like 350 to pass the exam. And when it comes to IELTS, so IELTS that the level is 7.77 to 7.5. Okay, so OET is something very different from IELTS, but I used here to explain you. So this is how it is given in IELTS and OET. We keep it as B, level B. Okay, but IELTS that's 7 to 7.5. Okay, fine. And other one is the skills required for the test. This is reading part A. 20 questions there. You have 15 minutes to answer. That's what I told you. This is going to be something tricky and you have to deal with time management in a very proper way, students. Time management is very crucial when it comes to reading. That means every minute is important. Okay. Yeah. So 15 minutes you have to write answers to 20 questions. Then the next one is part B and C. There we are dealing with some other questions and that takes 45 minutes. Okay. So overall that is 60 minutes for reading. Both B and C 45. Okay. And part A that is 15 minutes. Then writing part, as I explained you earlier, you need to understand the type of the letter and then you can't, if it is a referral letter, you can't follow the structure of a discharge letter. So you need to make sure that you follow the correct method or the correct structure of the letter. Okay, so and who is your audience and to whom you are writing and what is your main point? Are you including all the details? Are you excluding the unnecessary details? So all these things are necessary. Okay, plus the other one is speaking. This is what I told you, that warm-up conversation. Warm-up conversation means asking very simple questions from you to make sure, like that means so generally all the students feel somewhat awkward or somewhat nervous when facing the exam now. So then examiner will ask you some short questions. How are you today? And they are warm-up conversation and that will not be assessed. So no marks are given for your warm-up test. Okay. But first role play, so you have 2-3 minutes to prepare, generally 3 minutes to prepare. Then you have to start your conversation with the examiner. Then the second role play also very same, 5 minutes role plays there. Okay, so 5 minutes to role plays, that means 10 minutes role plays there. Okay, fine. Hope you got it. And then these are the common challenges faced by the ESL nurses or doctors. ESL means English as a second language. We are from Sri Lanka, so we learn English as a second language. And when it comes to the countries like Japan, China, so they learn English as a foreign language. We call them as EFL, no? Okay, and ENL countries, they are like Britain, America, so English as a native language. For us, English is second language. So ESL, we are ESL learners. Okay, fine. So the first one is, I have seen many students, they have limited medical terminology. So sometimes when it comes to speaking, they are, I don't know like how to pronounce this. You can't tell it like that. Okay, so you need going to talk with your patient. You will not be able to do it, right? So you are like that. You should have a kind of rich medical terminology. Okay, other one is pronunciation and clarity. That's not about you have to talk like a kind of native person. No, that's not like that. Just use your on like tone, intonation. You can use them, but your word should be very clear to the the listener. Okay, that's what it means. And you don't need to be like a native speaker, but your speech should be very clear. Other one is understanding fast-paced listening audio. So the listening thing is something very fast-paced. Paced in the sense it's something very speedy, so it will not be easy for you to grasp the point sometimes just because of its speed. Okay, so at least we need to have we need to practice more than 10 to 15 listening tests before writing the exam. Okay, because you have to listen to medical podcast. Okay, I have seen many students listening to medical podcast every day, morning and evening. So they listen to podcast to improve their listening. You can also do the same. Okay, and there are a lot of resources you can just use, and I will explain what are the resources that you should use. Okay, so especially listening to podcast, not just podcast, but medical podcast is something really important, or TED Talks. Okay, then you can do this. Other one is Reading. You have to read medical articles, patient notes, okay, and writing these three letters. And actually, I will be giving you feedback to every letter that you write. So that will be provided to you for sure. But at least we have to write 20 letters before writing the exam. Okay. Then writing referral or discharge letters. Like this is going to be something difficult to students most because sometimes they don't understand. Oh my God. So like you, I have written referral letter, right? Referral structure there. And the exam, they asked to write a kind of discharge letter. So that thing happened, I have seen. But you can't be like that. So you need to make sure there are some differences between these three. Okay. Other one is lack of confidence. There is nothing to be frightened because you are smart and actually you know what to tell. So nothing to be frightened, and we will practice some individual tasks as well. I mean, individually also, like I will be giving you some tasks. So we'll practice them, and we will be getting some support from another instructor as well. Okay. So fine. Other one is struggling with paraphrasing and summarizing. So this is something related to writing. There is another technique of writing called paraphrasing, summarizing. Okay, and direct quote, like direct quoting will not be, no, it's not. We don't teach direct quoting here. Only paraphrasing and summarizing will be enough. Okay, so these are the things that these are the things that we can say as challenges that are, I mean, challenges faced by most of the students. Okay, that means OET uh, students. Okay, fine, students. So other one is, yeah, so this is the end of today's session, and this is what I wanted to explain you today. So do you have any questions? That is not question, huh? So like it's something related to pronunciation. Some students say questions. No, questions is not a word, so that should be question. Okay, question. So these things are very, very important, students, because pronunciation and intonation, the stress, and we need to learn a lot of things there when it comes to speaking as well. And we will be learning them step by step. Okay, yeah. So, and if you feel like you don't have questions now, but if you feel like I should send my questions later, so kindly send your questions to our WhatsApp group, and we will respond by the end of the day for sure. Okay. And if you feel like these informations are not enough, I want to know more information. I have included the link here. You can go through this link and then find more information. Okay. Yeah, and this is the reference that actually I have used, and this is from official test. That means official website, OIT official website. Okay, fine, students. That's all about today's introductory session. If you have any questions, just ask, and I will be sending you the course content, the structure of the course, and actually, I think the dates are, I don't know, the dates. Have you received the dates, students? Dates of the classes? You haven't received the dates yet. No. Ah, okay. Fine. So these are the dates. So our like OIT classes, so Monday and Wednesday. So probably around 8 or 8:30. Okay, evening time, Monday and Thursday evening. Yeah, they are the time slots of our OET one, Monday and Wednesday, and you have like, I mean, probably this will take 3 months. Okay, so 3 to 4 months, better to say, because now I don't know your level. It depends on your level. So if you are a kind of upper intermediate, so probably it will take 3 to 4 months. And if you are 3 months, and if you are lower intermediate, so that means that's 4 months generally. Okay. Yes, that depends on your level, and we will do a kind of placement test to understand your level first. Okay. If not, it's not going to be something good. Okay, because first I need to know your level, then I can understand what kind of theory and what kind of strategies that I can use to teach you, because we are doing it by spending a lot of money, right? Okay, so then we should do some justice to your money. Yeah, that's what I wanted to tell you. So, fine, students, that's all about it. And all the things will be provided to you for sure, the course content and everything after your placement test. Placement test එක කියන්නේ ඔයගොල්ලෝ course එකට එන්න කලින් පොඩි test එකක් තියෙනවා to understand your level. මොන level එකේද ඉන්නේ කියලා බලන්න. Intermediate ද, upper intermediate ද, lower intermediate ද, advanced level ද. So, like that. And it's not going to be a very tough test. Okay. Like, yeah, it's going to be a simple exam. Okay, and it will take only 1 hour. So you have to do it and submit. Yeah, that's the process. I think it's better to do the placement test. Then you also can understand your level, and we also can get a kind of understanding about this student's level, and we need to improve this student this much at the end. Okay, fine. So yeah, placement test dates and those kind of things will be informed to you later, not now. Okay, fine. Yeah. Any other questions? Okay, no questions. Okay, that's so good actually because other sessions after the session, so they are coming up with many questions, but your batch is not like that. It's something. No, we can't say it's something good, but if you have questions, you can ask. No worries. Yeah, you can ask students, huh? Okay, no worries because you are the ones who are going to write this exam and then you should have questions about all this. No. Okay, so if you feel like it's better to ask questions in Sinhala, that's also allowed. Okay, so you can ask. So the time is given to you. Okay, so this is your time. And yeah, so that means I explained everything to the point. So then you don't have any questions. Okay, no, you should have questions. I know that's like I did it in a kind of somewhat speedy way. So you should have no questions? Anything? Or you understood everything I said, or you didn't understand? So then we can have like I didn't ask you some culturally sensitive questions, no? Okay, I just ask the questions related to OIT. Okay, so yeah, students. No, any culturally sensitive questions? Okay,
Excuse me, madam.
yeah.
දැනගන්න පුළුවන්ද අපිට රිෆර් කරන්න පුළුවන් මොනවාද බුක්ස් මොනවාද කියලා? ඒ කියන්නේ ස්ටඩි කරන්න
Well,
ඕන.
yeah. So, like, especially there are some books that are printed by the official OET sites, then you can refer them. Actually, there are a lot of books that you can use, like, but the thing is, it's not good to refer to all those kind of books, and you need to make sure first that so who published this book. Okay, so if it is from official OET website or like their thing, so then that doesn't matter. But if not, don't download everything given there. Yeah, that's it.
Thank you, madam.
Yeah, and plus the other thing is, if you are interested in, so like if you are interested in writing this test, what you can do first is just try to understand your level first. Okay, because actually we also don't know our level, no, so we speak English and we can write in English and we can understand when someone speaks in English. But the better thing is you need to understand your level students. Okay, so please try to understand like what is my level? What kind of learner am I? Okay, so after understanding that thing, then try to do things because there are a lot of things that you can do after understanding your level. Okay, for example, if you are a low intermediate English learner, then you can start with listening to podcasts, listening to TED Talks, reading comic strips, okay, to improve your English. Okay, so that is not all about watching English films and listening to English songs and not like that because you need to make sure what kind of learner you are. Are you a visual learner? Are you a kind of auditory learner? Okay, or kinesthetic learner? So just try to understand. So the better thing is it's better if you can do our placement test, and then we will provide you a kind of comprehensive feedback about, okay, so this is your level and this is how you need to improve yourself. So that should be your like the basis. Okay, if not, so what's the point of doing the exam? No, I mean, you also don't know your level. So first try to understand your level. Then do the treatments. Then that's fine. Okay. Yeah. Other questions do we have? Do we have other questions? No. So if you have any questions, just drop a message to us, like because we have a kind of group here, and then just drop your messages and we will reply. Yeah, students, that's what I wanted to tell you today, and I will be sending you this presentation as well. Okay, to your group now, just after this session. Okay, fine, students. Then we will wrap up the session now, and thank you very much for joining and your enthusiastic answers. You all supported me a lot to do this thing. Okay, so thank you very much. And okay, bye. Stay safe. Bye, everyone. Stay safe.
Thank you. Good night.
Okay, bye. Good night. Thank you.
Bye, madam.